main Medicare open enrollment period is now open. That period runs from October 15th through December 7th, during which you can make changes to your Medicare plan that take effect on January 1st, 2026. It's the one chance each year to make sure your coverage elections for the year before, from the year before are still the best fit for you. Premiums, deductibles, and prescriptions can all change year to year, so taking the time now certainly will help you avoid costs and surprises later. And joining us now is Chris Melee, the Vice President of Direct-to-Consumer Channel at HealthSpring. Mr. Melee, thank you so much for taking the time and joining us here today. El Paso and Las Cruces, both big retirement communities, retirement populations. So this topic applies to many of our viewers. Tell us, what are the different kinds of plans for Medicare and their beneficiaries?
Yeah, thanks for having me. Appreciate the time. Obviously, this time of year is really crucial. It's the annual enrollment period for Medicare. So it runs from October 15th to December 7th. And this is the time when people make plan selection options. And the type of options that exist out there are Medicare supplement options paired with a Part D plan. And in addition to that, there are options called Medicare Advantage options, which effectively take the different parts of Medicare, your Part A services for hospital, your Part B services for medical, so your doctor office visits, specialists, and then the Part D coverage, which covers your prescription drugs and amalgamates that all into one and integrates it into one program called Medicare Advantage. So what we recommend is that beneficiaries take the time to evaluate their options and shop for different plans during this period of time and enroll for 1/1/2026.
Yeah, and Chris, there's the main Medicare open enrollment period, and then separately there is the Medicare Advantage open enrollment period that runs from January 1st to March 31st. What are the main differences between those two periods, and what are the benefits of a Medicare Advantage plan?
Yeah, that's a great question. So obviously we're in AEP right now. October 15th it kicked off, so we're in the midst of it. So people are evaluating plan options, they're checking their providers, they're evaluating their different drugs and bringing them to either an agent or broker or their insurance company to evaluate options and make a plan selection. Once we get done with AEP, we go into what we call OEP, and OEP is effectively an opportunity for people who made a plan selection option and had some form of change. So this could be a change in their healthcare, this could be a change in their financial or economic means, and they need to make a new plan selection based on the choice they made prior, not aligning with their health and financial security goals at this exact time. So what's unique about OEP is that individual beneficiaries that made a selection can make a one-time change during OEP, but they cannot be marketed to by independent brokers, agents, and insurance companies for those purposes. So it's really a reactive state for beneficiaries to have the opportunity to make changes. For example, if their provider was looked up and was in network, and now their provider, their doctor, is no longer in network, they would want to make a change in OEP.
And of course, a lot can happen in a year like the situation you just mentioned. Also, people's health changes year to year, people's lifestyle, even budget changes. How do you factor in all those variables when deciding what the right Medicare plan is for you?
Yeah, again, everyone has a different health and financial security portfolio, right? Everyone thinks about their needs differently from a health perspective. It really depends on individuals' risk tolerance and really what they're looking for in a plan. So you think about the core benefits that most Medicare Advantage plans offer, much like we offer here at HealthSpring. You have things like doctor office visits, your specialists, you have inpatient hospital, outpatient hospital, you have your Part D coverage, which covers your different prescription drugs. But then you also have what we call supplemental benefits. So supplemental benefits within a Medicare Advantage plan offer things beyond the core benefits. So think of things like dental, vision, hearing, transportation, fitness memberships. So depending on your individual needs and really depending on your own personal risk tolerance, you make a plan selection when you sit down with a broker. You evaluate your needs, your risk tolerance, you go through a needs analysis, you look up your doctors, you check your medications, you run it through the algorithms that the agents have access to and the different tools and technology they have, and then you make a plan selection and enroll for 1/1.
And of course, with the passage of the One Big Beautiful Bill, there were some cuts to health care and other needs of assistance, which of course has been a real point of contention among Democrats as well as Republicans. Is there an impact from your position of the big bill on Medicare that beneficiaries need to be aware of during this open enrollment period?
Yeah, Andy, that's a really good question. And obviously, there's a lot of economic modalities in the Medicare space right now from both a regulatory and government affairs perspective. What I would say is what's important to a beneficiary near term right now is evaluating their plan options and understanding that not just with HealthSpring, but any company out there that's offering a Medicare Advantage plan in your local market, there are a number of different options, including HMO options, PPO options. You have what they call a Part B buyback option, which allows individuals to put money back into their Social Security check. And in addition to that, there's a myriad of different supplemental benefits offered within each of these portfolios. So you can look at different options that offer, different types of fitness benefits, different types of dental benefits. Each MAPD plan or Medicare Advantage plan also offers a different array of doctors. So while there may be some long-term economic impact to the healthcare business overall and to Medicare, I'd say near term, there's no major impact that impacts people's ability to be able to make a plan selection for 1/1/2026 and really move along their healthcare journey in a positive way.
We'll get you out of here on this one. We talk a lot about open enrollment during open enrollment, right? It makes sense. But is there anything that people should be doing throughout the year that might make this process a little less stressful come this time of the year?
Yeah, that's a great question. I think it's really important that people take opportunities to proactively focus on their healthcare needs. So it's not about the what if, it's more about the what now. What can you do now to improve your position? If you're on a current Medicare Advantage plan, make sure that you're taking advantage of the opportunities that exist within it. So in some cases, it's supplemental benefits like fitness benefits. You have a gym membership you can utilize, or transportation benefits or dental benefits. You can go get a checkup or get your teeth cleaning, depending on your plan option. In addition to that, a lot of health plans who offer Medicare Advantage programs offer what they call proactive member rewards. So taking advantage of what they call AWVs, an annual wellness visit or a checkup. If you're a diabetic, your HbA1c screening. So taking advantage of these opportunities really aligns to your personal healthcare journey and provides a more proactive opportunity for you to take control of your healthcare needs. In addition to that, some plans offer member incentives that actually provide a monetary incentive for members to take a proactive stance on their healthcare needs. So that's what I would recommend doing. Evaluate your plan options, speak to your broker or your agent about what your plan offers, and really go deep into the plan details to understand the nuances and really take control of your healthcare journey.
A lot of good information there. Mr. Melee, thank you for your time on this important topic. We certainly do appreciate your insights.
Thank you so much. Appreciate it, Andy. Have a great evening.